do this one. Okay, when it comes to cell injury, now all of you are aware of cell and its component, right? A cell must have organelles. Cell must have plasma membrane. The major things, if they're damaged, so we're talking, look, isn't the best way to study path or diseases at cellular level rather than studying the whole organ? Because if one cell is diseased, you can translate it to multiple cells. For example, when a virus infects a cell, all cell injury in those cases will be the same. It's the same virus. And the clinical manifestation of an injury depends on the extent of cellular injury. Is it one cell? No big deal. Multiple cell? Yes. It's a problem. So cell injury is extremely important. I think Shukrullah told me that he has gone with you over necrosis and apoptosis, right?
Yeah.
Okay, so it will be a review for you then. And it's on the exam tomorrow anyways. So let's talk about this. You have normal cell. Or just, let's put it cell. Okay. In this cell, usually cells, the environment of cells within cells and outside is highly controlled. That means, for example, you are in a controlled environment. You're within the hemisphere of Earth. If you go outside, there's lack of oxygen, you might have trouble. Here, when you go outside and cold, you might freeze, so you wear clothes. If it's warm, you will have AC on or things like that, right? So you're in a controlled environment. There's an optimum environment that is suitable for your survival. If there's external stress, let's say it's cold, it's hunger, you'll adapt. You might have to sell your car, your house, just get something small or rent out or do things to survive. I mean, we see examples in the other part of the world when there's fighting and then there's kids being washed on shores and things like that. People adjust eventually. That's adaptation. But the optimum environment is what we seek, all of us. At the end of the day, each one of us want what? Happiness for ourselves. And that's seeking optimal environment. And the best optimal environment is where you live forever and you have no sorrow. Some of us can picture, some of us can't. And those who picture it, they actually work for it. Those who can foresee what's coming up, or at least they can take a guess, like this is what could happen. And they do a lot of hard work. Every human being or everything has instilled in them this natural instinct of survival. And if you think about it, why would you have this instinct of natural survival? That means there has to be something. You cannot think of something that doesn't exist. You cannot think of something that doesn't exist. Therefore, everything that we can think of, that means it already exists. It's just we're discovering it. So I think there's also something called immortality. And that's what cells are too. Cells strive, struggle, work so hard to be immortal. But those cells who recognize that, they actually adapt. They're flexible. And there's sometimes they have to suffer. Sometimes they're happy just for that optimum goal. And that's translated into human beings overall too. Okay? So, of course, homeostasis is perfect, but sometimes environmental conditions don't allow that. So, okay, so let's say normal condition will be homeostasis. Homeostasis. Homeostasis, again, means keeping the internal environment constant. Keeping the internal environment constant. When I'm recording, if I keep this volume on maximum, is it good, or does it keep it here?
That volume
doesn't matter.
The volume is from the program itself.
Okay, let's keep it at half, so it's 50-50, whatever. So there you go, that's cell, natural environment. Right now, you guys are in homeostasis. What if you lose your job? What if there's a motor vehicle accident? What if you get a viral infection? What if you get diabetes? What are you going to do then? Your body adapts. What if somebody has heart attack? According to statistics, majority of us will have heart attack. Okay? And aging is also an issue, and I'll come to aging. So now that's one thing. Okay. Now, let's say there is a stress. Now, when I say stress, I'm not talking about psychological stress. I'm talking about physiological stress. environmental changes. So there's two things that could happen to this cell. I'm running out of room. And one would be the cell, if there is a stress that the cell could deal with, the cell can deal with it, it will adapt itself. So we'll talk about adaptation. I don't have room, you can finish adaptations. Or the cell can go through injury, true injury. Adaptation doesn't mean injury, it means you are able to cope with it by changing your behavior, by changing your looks, by changing your functionality, right? Okay. Now, injury could be reversible or irreversible. What do we call irreversible injury? Death. Exactly. Overall, this is what we're going to talk about today. Okay, this is what we're going to talk about. The cell can adapt, great. The cell can get injured and recover, or get injured, never recover. Okay? All right. Now, adaptations are reversible. Number one, adaptations are reversible. So let's, is it okay if maybe I'll switch it or take it to a side. You know, guys, no matter how you look at it, you have to find a way to be flexible and adapt. This is what human being is designed for, adapt. The only one who's successful in adapting and foreseeing and adapting to something that's coming even in the future, they'll be successful. The one who fail, this is so many examples in life, especially at cellular level. Those cells, or organism is a cell, a large cell, right? Collection of cells, who fail, they won't do it. They won't survive. So, and those of you who are successful will survive. And those of you who work hard towards that success, for example, in this case, you're step one, you'll succeed. There's no one who can stop you. It's only you. And I wish you look at cellular levels and these things and translate it to yourself. You will see where you are. It's crazy. It's crazy. It's unbelievable. Everything that happens in the body is exactly what we do. Every cell behaves like us. It's unbelievable. The more you study, the more you're like, wow, at molecular level, they're human beings, they call cells. It's crazy. They do something just like what we would do. Some are crazy, some are good, some are bad. Even sometimes cells, normal cells, get sick and tired of being good. For no apparent reason. They change their behavior. Nothing wrong with that. That's part of life. You know, because that promotes something good. And a lot of people would say, for example, if you don't know what is unhappiness, if you know what is sorrow, how would you know what's happiness? They're two contrasting, ideas. If you don't cry, you wouldn't know how to smile or laugh. So you have to know the opposite. So there's no way cells not going to suffer. You're not going to suffer. And it should only bring good out of it. Let me tell you a story. I have to tell this story, so please forgive me. I want to tell you this story. Sometimes when people go through struggle, for example, preparing for exams, and they fail or they don't do good on their exam, they get demoralized. And sometimes they give up, or this. But you're fully equipped to deal with that. I'll give you an example. Although, it is restricted to a specific culture, the story. So if you cannot relate to it, just get the meaning out of it. And you don't have to be, I don't know if you guys heard of Rumi. R-U-M-I, Rumi. Rumi is a, they say he's the number one seller in the United States for the last 10 years, 12, 15 years. His book. And that's only translated from Pashto and Persian into English. Rumi. He was born in 1200 in some city in Afghanistan, and then he went to, at that time, the superpower were in Turkey, I think, Istanbul, and he went there and taught in schools and stuff like that. But all his language is poetry. He tells you a story and then a poem. It's beautiful if you read it. Even in English, it's beautiful. It's crazy. I can read Persian or Farsi or Dari. I can read that language. For me, it's really, really easy. But even in English, when you read, it's crazy, unbelievable. One story he tells you, there's an older guy. In that culture, and back in the days, 1,000 years ago in Afghanistan, old people who had white beard, white clothes, and white turban, or in this case, like a hat of a, a professor graduating. That's what it meant. Today, it's looked upon differently. But so that was looked upon an old person with white beard, and Cain was looked upon like a angel, like amazing. He should be good. He's wise. He's this. He's this. So this guy's walking, and then he see another young guy, of course, reckless, right? The meaning here is reckless, young, reckless, old, wise. This young guy is sleeping under a tree, apple tree, and then this old guy grabs his cane, starts beating him without no reason. He wakes up from sleep and starts screaming, "Oh, what's going on?" And then when he sees this old guy, the conversation is beautiful because the young guy tells him like, "Oh my God, you're so beautiful. You're so pious. You're like an angel. How could you such an evil act? It doesn't suit you. Physically, when I look at you, you're beautiful. You're pious. You're this. All the quality and that culture that'll pertain to like something beautiful and pious and peaceful. How could you such an evil act of, aggression against me?" The guy goes, "Shut up and eat the apples." All the apples that are rotten fell on the ground. And he keeps eating. I mean, somebody might ask, like, the young guy's stronger, he should do, but because of respect, he doesn't do that. Again, he keeps begging back and forth, and he's like, keep eating. Eventually, the guy eats a lot of apples and starts vomiting. And when he vomits, eventually he vomits a huge snake. When he realized that he vomited a snake, he's like, "Oh, you are an angel. You're so beautiful. I was dead. And you give me life. Hadn't it for you, I would have been dead. The snake would have eaten me," and so forth. But during that process, he struggled so much. He was begging, "Oh, you make me suffer. You're this. You cannot be beautiful. You're evil. You're this. Until he realized that he was about to die. Hadn't for the old guy. So obviously, he seen him a snake go in his mouth, and he started beating him. So the idea is that sometime you will suffer through things, and you think it's bad for you. You'll be complaining, but you don't know what good is going to come out of it. So this course is tough. Trust me, this is tough. But you do have to give it time. You do have to give it time and be patient. And you will get there. You will get there. So, as I said, a lot of people think medical school is tough. And you've seen it's not tough, right? It's not tough. It is just us what we do. It's not tough. Okay? All right. So adaptation. Let's go over adaptation. Now, if you can adapt, you're successful. If you can adapt, you're successful. Trust me. It's true in marriages, it's true in parenthood, it's true in childhood, it's true in every communication. If you can adapt, you're successful. Okay? All right, and that's what we're talking about here, cells that can adapt. So let's talk about some adaptations, some types of adaptation. One of them is, let's say, atrophy. If there's atrophy, there should be hypertrophy, right? If there's hypertrophy, there should be hypertrophy. You know what, let me just close this. Okay, and there should be hyperplasia. And there should be hypoplasia. And of course, there should be metaplasia. Anaplasia. Okay. So these are some adaptations that cell will go through to make sure they survive, withstand the stress that's coming in their life. And who's the cause of stress? We are. We are the one. Let's start with atrophy. Atrophy means decrease in size and metabolic activity. Two things. Please understand. Atrophy means cellular size decreases. Decrease in size of a cell or group of cells. And decrease in metabolic activity. This will be you when you lose your job, when you have nothing else to look forward to. At that time you have a small income. What are you going to do? Eat less. And what happens when you eat less? What happens to your metabolic activity? Demands and activity decreases. And what happens to your muscle size overall and your body size? Decreases. Same thing. This is atrophy. Okay? And a good example of atrophy will be a person, let's say they got a motor vehicle accident or did a major surgery and now they're bedridden. And you see the calf muscles first. What happens to them? They atrophy. Right? But you have to know this. It's not like you have to memorize. You just have to know what it means and what can cause that. There's examples every day. It shouldn't be difficult to remember. Okay, so that's atrophy. Again, what are we going to focus on? Size and metabolic activity. Two things. Don't ever think in this case increase in number of cells. No, 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 no. Size of cells decreases. Metabolic activity decreases. So all these three. Trophy means growth in terms of size. Trophy. Not in terms of numbers. Okay? So hypertrophy would mean increase in size and metabolic activity. Hypertrophy is in between, so atrophy is worst case scenario. So in atrophy, cells will shrink in size and their metabolic activity will decrease. That's almost like Ramadan for those of you. Yeah. Every religion fasts. I apologize, maybe I should memorize. I know Christians have and Jews have something else. The seven bat. Oh. I need to improve on my knowledge of everybody. So, yeah. Homer?
Hypertrophy, there's an increase in metabolism?
Yeah. Hypertrophy, there's increase in size and metabolic activity. Now hypertrophy, I will ask you. Step 1 will ask you. NBME will ask you. USMLE will ask you. Usually they will give you a picture of the heart. In the condition, you should think about a hypertrophic cardiomyopathy. Write it down. Hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy. Now, hypertrophy occurs in athletes, people who lift weight. People who lift weight, now, let's say they're doing their bicep muscles. Do the number of those biceps muscle cells increase? No, you know that skeletal muscle has no ability to increase in number, and it's very slow. They have the ability, I apologize, but it's extremely slow. By the time your skeletal muscles duplicate, maybe it's 200 years or something. You know, so, but it's no use, right? But anyhow, hypertrophy means increase in size and metabolic activity. For example,
Increase in metabolic
activity and increase in size. For example, your heart. Let's say you have hypertension. Increase blood pressure. Increase in blood pressure. What does that mean? So all of you have a heart, right? A heart looks something like that. And then they have this major vessel called aorta, correct? Between the heart and the aorta, don't you have a valve? One-way valve, which prevents backflow, only allows forward flow. True? Okay, so let's call this valve aortic valve. Aortic valve. So, for example, aortic valve can only open in this direction. And if pushed on this side from the red side, it will close. The two leaflets, right? They will close. It's a one-way valve. Now the question is, doesn't the heart have to pump against this valve? That means the heart has to produce and create some pressure. So larger, greater than the pressure of the valve. So it opens. Otherwise it will not open. What happens in hypertension? Hypertension means blood pressure where? Not within the heart, within blood vessels, especially aorta. So if you have more pressure in the aorta, doesn't that mean that there's more pressure pushing against this valve? Yeah. So the pressure on the red arrows, that means they're pushing from the opposite side. And now you need twice as much more pressure from the heart to open this valve. Don't you think the heart has to hypertrophy? It has to. It has to strengthen its muscle. Also, the demand for such an active heart, for such a strong heart, has to be more. That means its metabolic activity will consume more energy. And such hearts will be more at risk of ischemic attack if there is ischemia. Because they demand more, they eat more, they take more oxygen, more nutrition. So it's a clear cut, very easy, straightforward to understand, that one adaptation is, if there's more workload over you, you're going to get stronger. And of course, to get stronger, you need more nutrition, and metabolic activity has to increase. So one example of hypertrophy is what? Very good. Hypertrophic heart. And hypertrophic cardiomyopathy usually occurs in young people. And it's not because of some abnormal activity. There's a genetic component to it. And it's okay in healthy people, young people, unless they are soccer player, basketball player. When there's too much activity, it becomes a problem. Because when the heart becomes thicker, what happens to the chamber inside? It gets smaller. That means you cannot pump much blood now because the chamber is small. So when you do extensive activity, a lot of soccer players will die on soccer field. A lot of basketball players have died on basketball court while they're playing or practicing because of this. Okay, so there's a genetic component. Not everybody has it. Those who are at risk, the family history will help us. We'll do this in the cardiology section. But for now, understand hypertrophy. A good example of that is hypertrophic cardiomyopathy. Okay. Now, as long as you understand when the cells metabolic activity and size increase, it's called hypertrophy. If the cell size and metabolic activity decreases, that's atrophy. Hypertrophy comes from more demand. Atrophy comes from insufficient nutrition, lack of resources. Okay? So lack of resources, atrophy. Lack of activity, atrophy. Now, if you think about it, what if your neurons, the atrophy thing comes from lack of use. What if you're not using your neurons? That means you can do something about Alzheimer's. Alzheimer's is what? Death of neurons. So if you are involved in activity that are positive thinking and things that can promote more planning and stuff, that means you will not get Alzheimer's earlier on. Probably you can delay it by a few years. The more you use your cells, the more active they become, the more stable they will survive more likely. The least you use them. And this is why it's sometimes difficult, people who have certain ideas, mentality. Part of the brain, brain needs to be trained. They need to adapt. Adaptation occurs over a period of 1 night, 1 minute, 1 second, or many days, or many years. Many years. So if you're stuck with one type of mentality, and you're not able to change it earlier on, it will be very difficult. Very difficult. Because those set of neurons that can think collectively, spontaneously at the same time, boom, and come to the right conclusion, it takes time. They won't be able to. So some criminals, for example, and some people who have different personalities, type A personalities, angry personalities, it's difficult. It's very difficult for that reason. Adaptation takes time. And the moment you expect somebody to change overnight, you will fail. Which means you have to be very patient. You have to expect as a physician, if you want your patients to be compliant with medication, it's not going to happen overnight. If you want drug abusers to quit, it's not going to happen overnight. In this case, let me talk about smokers, because we should not have drug abusers here, but I think we probably have some smokers. So it takes time, and you have to be patient with yourself. You have to expect these realities. There's no magic to it, and there's no crazy things like in the movies. So adaptation takes time. It takes time, it takes time. Okay, hyperplasia. Hyperplasia. Now, hyperplasia Plasia means number. Trophy means size. Plasia means number. Hyperplasia means increase.
What was hypertrophy?
It's same thing as atrophy. Yeah. Size will shrink. Yeah.
Metabolism too?
Yeah. Of those three that I said, same thing. They're about size and metabolism. Hypo means less. A means without. So A is severe form. Atrophy is severe. Okay. A in Latin means without, or extremely severe form of it. Hypertrophy means small shrinkage. Size changes a little bit, and metabolic activity decreases a little bit. Atrophy means severe form. And think of atrophy always skeletal muscles. For example, you have a nerve injury, a nerve is cut off, and there's no supply to those muscles, and they'll atrophy because you can't use them. Okay? When it comes to muscle, it always comes to use. For example, people who don't do much activities and just sit around most of the time, or their job is something like that, they'll have weak muscles, floppy muscles, decreased tone muscles, and their size will shrink. Okay? Okay, so hyperplasia. Hyperplasia means increase in number, nothing to do with metabolic activity. The term literally means increase in number. Increase in number. Okay? So plasia means number, hyper means high, increased number. And the term hyper does not mean just high, it means abnormally high. Please understand, in medical terminology, when you use the term hypo, it means less than normal, which is physiologically not a good state. It can become pathological. Hyper means above normal. It's not within their normal range. Hyper means above the normal range. Hypo means less than normal range. So these are not normal states. For example, hypoglycemia is not a normal state. Hyperglycemia is not a normal state. Euglycemia is the normal state. Okay? Let's talk about something else maybe you can relate to. What is your body temperature? 98.6, something like that. Okay? Now, if it's too high, that's hyperthermia. And what do we call hyperthermia? Fever. None of you like fever. Right? And if it's less than 98.6 and you're freezing, hypothermia. And none of you like that. That's why you're wearing jackets even in class. Is it cold in here? Increase the heat then. Those of you know, you should be right behind the wall. Okay. So hypo and hyper does not refer to a normal state. It refers to abnormal state. Too much or too little. Hypo, too little. Hyper, too much. Good? Hyperplasia means increase in number. Hypoplasia means decrease in number. Similarly, let's go to anaplasia. Anaplasia means severe decrease in numbers. Plus, the structure is affected too, like disorganization. Now, when you talk about these, hyperplasia, hypoplasia, anaplasia, these are characteristics of cancers. Cancer. Abnormal growth. Hyperplasia, abnormal growth. Hypoplasia is actually completely different, which will happen due to viral infection or something else. Okay. Metaplasia means change in the physical look of cells. Change in phenotype. What's phenotype? Physical characteristics, looks. Now, although this has nothing to do with it, but I'll give you an example so you can relate to. Bruce Jenner's, was it, right? That's the correct name, right? He changed his gender or his sex. That's metaplasia, and that's, but it's cellular level we're talking about. So when epithelium changes from one type to another type, it's metaplasia. Change in shape and structure. It's not numbers. Metaplasia is not numbers. Hypoplasia and hyperplasia is numbers. Increase in number and decrease in number. Okay. Let me give you an example. Hyperplasia. Now, when you have cells increase in number beyond the normal number, you call them cancer. Depending, or you can say benign tumors. Let's just say tumors, because tumors can be benign or cancerous or malignant. So nonetheless, it's increased growth or tumor. Tumor means growth. A mass that is because of growth, it increases in size. So usually tumors have these characteristics: hyperplasia. Let's say I have a small mole here, or just a small pimple. If it's not controlled and it keeps growing and growing, what could happen? Get bigger and bigger. That's hyperplasia. So there has to be some sort of control to prevent cell growth forever, which is cell cycle. I think we'll talk about on Wednesday in cancers and neoplasia. Okay, so characteristics of tumors is hyperplasia. All cells that go to the stage hyperplasia, you call them tumors. Now, if they're malignant, they travel, they're invasive, then you call them cancer. If they are benign, they don't do anything to that extent, they call them benign. Yeah?
Can a cell be hypertrophy and hyperplasia at the same time?
Excellent, yes. Yeah. Yeah. Those cells, I like when you guys ask questions, because otherwise I would have not talked. Thank you. So those cells that have the ability to divide, they will have both characteristics. Cells that have the ability to divide, they will have both characteristics, hyperplasia and hypertrophy. Non-dividing cells only have the ability to become what? Hypertrophic or atrophic. Non-dividing cells cannot go through hyperplasia. How could you have extra number of cells if they can't even divide? That means mitosis and meiosis is required for what? For hyperplasia. Non-dividing cells. Let me give you an example of some non-dividing cells. Non-dividing cells is neurons, brain tissue, skeletal muscle, and cardiac muscle. Usually they don't divide. That's why damage to them is permanent. Stroke, permanent damage, at least for our lifespan. Myocardial infarction, permanent, or heart attack. That's why we'll suffer from it. But if your body can repair it, wouldn't be a big deal. That means there's no repair, replacement of those cells that you just lost. Skeletal muscle, same thing. Now, if you think about it, cells that are hyperplastic, what does hyperplastic cells mean? They have too much hyperplasia. That means they can divide faster. White blood cells, red blood cells, okay? GI cells, epithelium of your GI. Skin, you can scratch it, no problem, comes back. Okay? All right. So metaplasia, let me give you an example of metaplasia. Metaplasia is the underlying cause of esophageal cancer, or GERD. Let's just talk about this GERD. Gastroesophageal reflux disease. See, in the lower esophagus, the epithelium is squamous. In the stomach, it's what? Columnar. We talked about this. This junction, what if acid refluxes into the esophagus? Esophagus is not designed for acidity. It can't withstand it. Stomach is. Gastric epithelium can actually tolerate acidity, correct? If you couldn't tolerate it, you wouldn't have acid in there, right? Common sense. That means when acid goes into the esophagus, let me do a drawing for you. So here you have this junction. I'll use green. This junction between stomach and esophagus is very sensitive. Now let's say this red acid, somehow the gastroesophageal sphincter, the lower gastroesophageal sphincter or valve does not close. Let's say you're nervous, you stress all the time, or you eat spicy food, or you eat chocolate a lot, or you smoke a lot, or you take nicotine, whatever. Those are the things that will keep this valve open. If it stays open, don't you think acid will reflux? Because the stomach is almost like you take a bag and fill it with acid and you just shake it. That's what stomach does. It churns and contracts and squeezes in all directions, so that means acid can splash all over in all directions. So if it goes there, now the esophageal epithelium isn't designed for this. And it'll get irritated, it'll get damaged, and it'll cause heartburns. or chest pain in this case. Okay? So now the epithelial cell says, oh my God, this person's so mean, he just poured acid on me. What a mean person. And says, you know what? Hopefully he doesn't do it next time. But guess what? It happens again. It happens again. And then the esophageal cell, the squamous cells get sick and tired of you. And it says, you know what? This person won't learn his lesson. What I'm going to do is he won't quit smoking. He won't stop doing those things that are damaging to me. I'm going to change my shape so I can withstand these. I'm going to take an umbrella, cover myself. So they change their shape to columnar. And you will call this gastric metaplasia, because esophagus, its epithelium got replaced with gastric epithelium. And what is gastric epithelium? It's resistant to acidity. So it changes. That's metaplasia. Changing from squamous to columnar. So you will call this columnar metaplasia or gastric metaplasia. The columnar epithelium of stomach produces tremendous amount of bicarbonate or antacid, natural antacid, not the one sold in Walgreens. Okay, and that bicarbonate will neutralize, or mucus, you can call it mucus as well, will neutralize what? Acidity or acid. Bicarbonate is a huge buffer in your body, huge. Okay, so that's example of metaplasia is one GERD. Now also example of metaplasia can be cervical cancer or cervical neoplasia. In those cases you can have metaplasia and hyperplasia at the same time. See, metaplasia, when it becomes hyperplasia, it becomes cancerous. Essentially, initially it's metaplasia. It tries to survive, it wants to adapt. But you keep pouring acid on them over and over, and they keep getting damage and damage. So your body says, you know what? Each time these people or this person is killing my cells, my population, my people, and they keep producing more and more. And eventually they get out of hand. They produce so much that it's no longer a controlled cycle. You produce more cells than you can kill, and then that leads to cancer. So cervical cancer or cervical neoplasia. Neoplasia means new growth. Neoplasia, you will learn it on Wednesday, means new growth. Or anaplasia or hyperplasia, okay, or cancer in this case, and esophageal cancer. So GERD, esophageal cancer, cervical neoplasia. Look for those things. That's example of metaplasia. Example of hyperplasia is any tumor. Hypoplasia is rare, but unless, as I said, hypoplasia is usually viral infection, and then the cells are killed and damaged, and the replacement is much slower, or some absorptive diseases. Anaplasia means disorganized growth, so that's for cancer, I'll leave it. Atrophy, hypertrophy, we talked about it already. So these are some adaptations that cells can do to survive. Yeah?
What would the cervical metaplasia epithelial change would be?
From squamous to columnar. Yeah. Okay. Cervix is squamous and endometrial tissue, or cervix has two parts. Endo Cervix, which is inside the uterus slightly. It's about 10 centimeters apart. You know, cervical os has an internal os and external os. Os in that os means opening. There's an opening between the uterus on top and cervix, right? Cervix is the junction between birth canal and uterus. Let me do this. Let me do this so we can take a break right after this. Oh, let me use my skills. I forgot. There you go. Okay, so I'll use this blue part. This is cervical os. Although, you know, it's very thin, the size of the tip of the pin. This opening is very small, okay? In birth, it expands, right? So, and that's one sign for pregnancy, you know. Labor. When the female is going through labor, you have to measure the size. And the cervix, the thickness of the cervix has to become paper thin, like the term for that is effaced. You will learn it in gynecology, right? So, but anyhow, so this part in red and then blue. Blue is the Endo Cervix. And this green part, this part is Ecto Cervix. Okay, and then let's just say yellow right here. This is Endo Cervix. So inside of the opening, the inside is known as Endo Cervix, outside is Ecto Cervix. Let's see, up to here, all of this is Ecto Cervix. Ecto Cervix is squamous epithelium, stratified squamous epithelium. Endo Cervix is columnar epithelium, columnar. Okay? So HPV virus, for example, human papillomavirus, loves squamous epithelium. So it infects this area and causes metaplasia. And that can lead to cancer eventually. Okay, let's take a break.